Healthcare professionals and patients know all too well that not everyone responds to a medication the same way. But why is that? Sometimes the answer is found in our genes. This video follows a patient whose healthcare team uses genetic information to guide their care. It's an example of precision medicine that's used in some clinics today.
I understand you're here for a test related to your new medication?
Yes, well, I'm a little confused. I did start taking a new medication after I had a heart attack, and they used a balloon to open up a blocked artery. It's supposed to help keep that from happening again, but now I need to take a test to see if it's working.
After your procedure, your doctor put you on standard medications to help prevent a future heart attack or stroke. Let's see. Yes. According to your chart, one of them is a blood thinner. It's a medication that's a good place to start, and it works for many people. You're here so we can make sure it's the best fit for you.
That's the thing. My doctor said I need to be on a blood thinner, and now I'm on one. Shouldn't that be it?
It could be, but not every medication works the same for every person. Like, have you ever noticed how many options there are to treat a headache? People often have one they prefer because it works best for them with few side effects. It's the same for many medications.
Why is that?
Well, there's a lot that goes into it. Your lifestyle, age, other medications, and overall medical health all matter. Your genes can play a role too.
The first part made sense, but my genes?
Yes. In addition to the visible traits like hair color or height, our genes can influence things we can't see, like how medications affect us. Imagine a group of people. They're all given the same medications for the same illness. Now, like all people, everyone in the group has the same genes, but genes come in different versions. It's different gene versions that can influence what happens with a medication. Some people do well, some people get no benefit, and a few get bad reactions or side effects.
And this applies to my new medication.
Exactly. There's a test we can use to check which version of a specific gene you have. The result could tell us if your new blood thinner is safe and likely to work for you, or if you might do better at a higher or lower dose or on a different medication entirely.
I've never heard of that.
It's called a farmacogenetic test. We don't have them for most medications yet, but we do have them for a few.
Farmacogenetic.
Pharma, like in the word pharmacy, refers to the science of how drugs work, and genetic means having to do with genes.
Ah, got it. What happens during the test?
Well, genes are in nearly every cell in your body, including some blood cells. So we draw a small amount of blood and look at one specific gene your body needs to use your medication. We'll check which version of the gene you have and send a report to your doctor. She may decide to adjust your medication. The test result will also be listed in your health records in case it applies to any future medications you need.
That sounds great. I'd like to get tested.
Great. I'll get the test ordered, and then you can head down to the lab for your blood draw. Well, your test results came back, and they told us the medication you were taking probably wasn't the best fit for you. I spoke with your doctor, and I understand she already switched you to something new.
Yes, she did. She did some other tests too. The new medication is working. My numbers look great.
I'm happy to hear that.
Thank you for watching. This story shows a person's genetics contribute to their medication response. Farmacogenetic tests check for differences that may affect how well a medication works. This video was produced for the All of Us research program to help people visualize how pharmacogenetics could be used in healthcare. At All of Us, we don't treat patients, but we're supporting research that we hope will make more experiences like this possible for all people. To learn more, visit joinallofus.org.